COVID-19 pandemic highlighted the need for widespread use of CGM to give more people with diabetes the additional information they need to better self-manage their diabetes and to give them the ability to upload glucose data to cloud-based systems in order to obtain medical advice remotely. Whereas this is important for routine clinical care, it's extremely valuable during times of stress, including acute illnesses such as COVID-19, when unanticipated hyperglycemia and wide fluctuations in blood sugar levels are common. Understanding your glucose readings, the direction in which they are going and at what velocity, and the availability of alarms to alert for serious hypo and hyperglycemia have been critical. The goal is usually to keep as many glucose readings as possible within target range, which for most people is 70 to 180, while avoiding hypoglycemia. During acute illnesses, I try to keep glucose readings between 80 to 180 for most adults and 100 to 180 or even 200 for the elderly or frail to reduce their risk of hypoglycemia. With COVID, avoiding both hypo and hyperglycemia are thought to help prevent or mitigate cytokine storm, which is associated with worst COVID-related outcomes. Depending on the severity of the illness, glucose readings can fluctuate widely and quickly. As with any infection, hyperglycemia is common and can be unrelated to eating. With COVID-19, there can be mild illness, more commonly seen in people with diabetes who have been fully vaccinated and boosted, or moderate disease or serious devastating illness requiring hospitalization and associated with worse hyperglycemia. Avoiding hyperglycemia is associated with better outcomes with COVID. So for people taking insulin, higher insulin doses are commonly needed. For people not taking insulin, insulin may be needed during acute COVID illness. The use of CGM is particularly helpful since it not only provides glucose readings every few minutes, but shows the direction of the glucose readings in real time. This gives the individual time to react to glucose readings that are going too high, for example, by giving supplemental insulin, or too low by consuming glucose. If CGM is not available, blood glucose monitoring should be done before meals, 2 to 3 hours after meals, bedtime, and with more severe infection in the middle of the night. If there are more severe symptoms, such as nausea, vomiting, diarrhea, and/or fever, or in the presence of serious hyperglycemia, positive ketones, or not eating solid foods, finger sticks every 2 to 4 hours can be needed, as well as ketone testing, particularly for individuals with type 1 diabetes. Remaining well hydrated is critically important. People with diabetes on complex insulin regimens should consume liquids every hour while awake. If unable to eat solid foods, they should consume sugar-containing liquids every other hour. If the glucose levels are extremely high, consume less sugar-containing liquids and consume more if the glucose readings are within target range but falling, with the goal of keeping blood glucose readings within the target range. While some people refer to supplemental or correction doses of rapid or short-acting insulin given every 3 to 4 hours during acute illnesses, sick day boosters. Sick day boosters should be used when the glucose is over 250 in addition to the usual insulin regimen. These additional doses of rapid or short-acting insulin are usually 10 to 20% of the total daily dose, but can be much higher with more serious COVID infections or when ketones are present. If using CGM, this dosing can be adjusted depending upon the direction of the glucose readings. For example, if the arrows on the CGM indicate a rapid rise, more insulin would be warranted to get the glucose readings within target range. If the arrows on the CGM indicate that the glucose is rapidly falling, consumption of sugar-containing liquids or food is indicated. Patients should be instructed to call their healthcare provider if they're unable to keep fluids down, if they have a fever of 101 or higher, If the glucose is over 250 and the urine ketones are moderate to large, or the blood ketones are 1, particularly after a sick day booster, or if the urine ketones are small or blood ketones are 0.6 to 0.9 after 2 sick day boosters. For insulin pump users with unexplained or persistent hyperglycemia, the person with diabetes should change their infusion set and site. They should give a correction or sick day booster by injection if they suspect pump malfunction or a bad infusion site. Individuals taking an SGLT2 inhibitor, and occasionally others, especially if insulin requiring, can develop diabetic ketoacidosis with glucose readings less than 250 and should check urine or blood ketones if they have nausea, vomiting, abdominal discomfort, or other signs of possible DKA. For people with type 2 diabetes not taking insulin, persistent glucose readings over 250 with COVID should trigger a call to their healthcare provider. Well, certainly if there's difficulty breathing or shortness of breath, if there's persistent chest pain or pressure, any new confusion, inability to awake or stay awake, the lips or face look bluish, inability to drink fluids, those were all indications that the individual should go to the emergency department. The use of CGM helps people with diabetes keep a greater percent of their glucose readings within the target range, reducing hypoglycemia, that is the time below range, and hyperglycemia, the time above range. When using CGM, use of the arrows and the ability to observe glucose patterns frequently help direct insulin therapy and the oral intake of sugar-containing liquids or food. Higher insulin doses are usually needed when infection occurs, including with COVID-19. For more information, please visit the American Diabetes Association Time and Range website at professional.diabetes.org/time and range.